So my name is Daryl Eber. I'm a practicing radiologist in South Florida. We have 3 centers opening up our 4th in a couple weeks. I'm going to talk about increasing MRI efficiency and the bottom line. So this is more a case study on operational efficiency with SwiftMR rather than more clinical. Again, my name is Dr. Daryl Eber. I'm a practicing radiologist. I practice mostly private practice, but also in academia. We currently have 3 centers. One's in Coconut Creek, Florida. The other's in Aventura, and one in Miami Beach. Soon to have one in South Miami. We're a physician-driven and patient-focused practice. We have subspecialty radiologists, and this talk, even though it covers more operational efficiencies with SwiftMR, there's an underlying theme of high quality. That's very, very important to me personally and to our practice. So, as many of you know, MRI is becoming much more complex. We're all facing longer and longer, more complex MRIs. But when you look at what this does to your business, if you have an outpatient MRI practice, it can actually really encumber the business. You have longer business hours, meaning you have to pay your employees more. You also create backlogs, longer wait times, and it's highly competitive in the outpatient imaging world. So they can just go to another imaging center. So obviously you want to decrease your backlogs and wait times. But also during the scan itself, there's discomfort for the patient. That can lead to more patient motion, rescans. You have to fit them in. They have to get a diagnosis. They have to get treatment. And the other thing is when you try and add new types of studies, including whole body MR, the patients are deterred due to the long wait time. So these were big challenges that we faced that we needed to solve. So our goals, obviously, we want to decrease the individual scan time for each MRI, which what we've been able to do is, on average, decrease it by 30 to 50% in total scan time reduction. We want to increase our overall throughput. We saw an increase of 42% in total scan volume. Obviously, that leads to a positive return on investment, which we saw in the first 2 months. We want to reduce the backlogs and wait times like I talked about, and I'll go through some specific numbers. The other thing is, which was a nice outcome, was decreasing overall business hours. So your FTEs, you can decrease your total FTE. So the 42% scan volume increase within the first 2 months generated us an extra $205,000. We went from 20 to 30 scans per day to 30 to 40 scans per day. So the thing that this allowed, again, one thing that we focus on is the patient experience. So we want to have not just a comfortable scan for a patient, we want to have a high quality scan for a patient, but also be able to see the patient when they want to be seen. So we're now able to see more walk-ins. We can squeeze patients in. We can accommodate difficult patients, which, as many of you know, one patient at the beginning of the day, it's like the butterfly effect. When you have a patient that kind of goes wrong, maybe difficult to get on or off the table, it'll kind of ruin the whole day. So it gives us a little bit more wiggle room. Our non-contrast studies, we've gone from a 5-day wait time to a 1-day contrast study. 2 weeks, it really was 1 to 2 weeks. And now we've gone to about a 5-day wait time. And also the fewer repeat scans because of both decrease in patient motion and also decreased artifact. What we saw, again, this is kind of a round number for us, but we decreased our total business hours by 22 hours. And we were open 7 days a week. In one center, we're open almost all the time up until 12 to 1 a.m. in the morning, and then opening back up at 6 a.m. Then when we implemented SwiftMR, we actually went and looked at the OEMs. We looked at other competitors' software. And so for us, again, it was both a decrease in scan time, but also an increase in overall quality. So when you compare the SwiftMR solution to some of the OEMs, they're offering the same capabilities and benefits, obviously, to decrease costs. Then, it can work with all of our MR scanners. We have 3 TMRs, all Siemens. They work great with that. They also work with 1.5 Teslas and other manufacturers as well. The other thing that's really great about SwiftMR is the implementation, which I'll go into, but also they provide updates at no additional cost. That's really important. Some of the OEMs will charge you for additional updates. When you compare it to other third-party solutions, and again, I had other radiologists, subspecialty trained radiologists, really focusing on quality, take a look at the images and make the decision with me. And we thought that it provided better image quality. And again, we looked at multiple studies. Obviously, it's very MSK focused, but we looked at body. That's kind of my specialty. So the quality plus the additional acceleration. The implementation also was very, very simple. And it's not just the implementation when you first start. It's also when we add new studies, including whole body MR. They work with us. They're able to implement any changes very fast. And again, that's been kind of an iterative process in and of itself with whole body MR. I don't know how many people are familiar with that, but that's something that we have to work together to kind of make it even better. And then also the additional denoising, resolution, customization options available for all body parts. Again, kind of really, really big on whole body MR. So when you look at the individual numbers, again, you'll see this stuff, but it really is true. You'll see significant reductions in scan time. And again, you can see some of the bigger efficiency gains were in MSK, but also in neuro. And body as well. I would say that probably some of the biggest gains you get are in MSK, and the MSK studies are kind of, the bread and butter of any outpatient imaging center. And here are just some images to go through. Obviously, we can go through more examples. I can go through personal examples at the booth. But, when you look at the cervical spine, you can see kind of the conventional scan, and you may not be able to tell, but when you're actually looking at it on a diagnostic monitor, you can see that it's been denoised. The quality of the image is better, and I think you're getting the same or better diagnostic quality. And even here you can see kind of when you look at the vertebral body, again, the last speaker kind of touched on this stuff, but it's very similar that you get a much better quality image. And it's also, I happen to be one of the radiologists that go through and discuss cases with patients right on the workstation. And, showing these images when they look really pretty, they don't know what they're looking at, but when you have a really nice image and you feel very confident and proud of it, it means something. And again, here's the lumbar spine. You can see on this too, you can see a decrease in overall noise. So again, overall results and my recommendations, again, we saw a 30 to 50% increase in daily scan volume. That's pretty important, especially when you have decreasing reimbursement in the outpatient setting. It's not like in the hospital. We want to maintain and improve image quality. That's very important to us. Reduce our overall operational business hours for cost savings, and then obviously the additional revenue. And that's it. So I'll be at the AIRS booth afterwards, and I'm happy to answer any questions you have or give recommendations and go over specific examples. Thank you.